I didn't even realize that my behavior had become so erratic.
I had an issue with both substance abuse as well as there was a medical/mental health component to my background.
I ended up diverting opiates from the workplace when I was working in the emergency room.
Nurses perform incredible deeds daily in the face of an emergency or danger.
So when I think of the word nurse, I think of somebody that really wants to care for somebody.
We advocate for patients, even when it means flying in the face of, objections.
Nurses provide help for those unable to help themselves. But what happens when the caregiver needs help?
I wanted to care for somebody, yet I couldn't even care for myself.
I did not realize the depth or breadth of what this disease really did and the treatment that was available for it.
The intervention program through the California Board of Registered Nursing, BRN, is available to help and provide support during your path to recovery.
That last day of drinking, actually, when I called and asked for help, it was during a blackout. And to this day, I really don't know what I said, but I got the attention of the people I needed to help me.
Completely voluntary and confidential, the intervention program is designed to help California RNs rehabilitate and return to safe nursing practice without disciplinary actions against their license. The program was developed by BRN for registered nurses whose professional and personal life may be in jeopardy due to a substance use disorder or mental illness.
I just felt support right from the very beginning. I never felt judged. It just felt like everyone was on your side and wanting you to succeed and willing to help you to get there.
Eventually, through time, I got to see how they really were just there to support me and to cheer me on because they really just wanted me to succeed.
A lot more interaction with my case manager here. She said, when you have problems, that's when you call me. And when nobody else cared, she did. So that, more than anything, was probably a huge factor in my success.
With a focus on encouragement, support, and guidance as an alternative to disciplinary action, BRN's intervention program strives to identify symptoms, intervene, and change the outcome to get you back on course and doing what you love at work and at home.
I don't know how or when the magic started to happen for me, but I was starting to get things, just doing the work of the program every single day.
Life is just calm. It's not got that kind of up and down roller coaster that it did at one point.
This program here is a life-changing experience, and this is an opportunity that may only come once in a lifetime at least for me.
I would say if you're at the point where you're questioning, that's the point at where you need to reach out for help.
If you are just done living the way that you're living today, and if you know that there's something better for you out there, just know that there is. You just have to take that first step.
If you suspect that you need assistance, know an RN who may be suffering from a substance use disorder or mental illness, or have questions about the program, please call 1-800-522-9198, 24 hours a day, 7 days a week, or visit our website.
We owe it to ourselves to be our own best advocate. And we are darn good about it when it comes to our patients. So we ought to at least give ourselves that same opportunity.